From KLCC Studios, this is Oregon on the Record.
I'm Michael Dunn. Oregon isn't shy about pushing the envelope of controversial policies. The state was the first to legalize psilocybin services and one of the first to legalize recreational cannabis. And of course, the state passed Measure 110 back in 2020 to decriminalize possession of some drugs. Today, however, some groups are pushing back and saying that Measure 110 went too far and point to it as a reason why overdoses are on the rise. And the numbers seem to back that up. Opioid drug overdoses are skyrocketing in Oregon, with nearly 1,000 last year alone. Yet a study by epidemiologists of Measure 110 say, hold on a second, while yes, overdoses are increasing, they are rising in every other state in the West, none of which operate under a Measure 110-like policy. Today on Oregon on the Record, we'll talk with an author of the study, local law enforcement, legislators, and a formerly incarcerated individual to learn how we got into our drug overdose mess and how we might get out of it. Today on Oregon on the Record, we'll dive into this controversial issue and talk with experts on both sides of the Measure 110 and larger drug policy debate. From the author of a study which disputes the harm from Measure 110, to a police officer who sees the damage on your streets, to public health officials and legislators who wrestle with the right kind of laws, you'll hear authoritative voices on all sides of our drug issue. And you'll also hear from someone formerly incarcerated for drug use who now helps the state develop policy. The first guests you'll hear is an Oregon legislator and co-chair of a new committee that's evaluating drug policy in Measure 110, and then a coordinator at Lane County Public Health who says we need to increase funding for education and interdiction. Oregon Representative Jason Krupp from Bend, thanks so much for jumping on and talking with us.
Yeah, my pleasure. Thanks for having me today.
Yeah, you're the co-chair of this Joint Interim Committee on Addiction and Community Safety. Let's start off with this. Why was this committee formed?
This committee was formed to be the hub of the hub legislative committee to tackle issues of addiction here in our state. So we're getting ready for the short session in 2024, and so we're having this committee be prepared to get some legislative work done in 2024, but also continue that work on for the next legislative session. So what we're doing in this committee is making sure we have Senate participation and House participation, that we have members who have traditionally worked in the public health space, and we have members like myself who've traditionally worked in the judiciary space. So bringing those two perspectives together to help tackle the addiction crisis.
Is there an ultimate mission of this committee, an ultimate product, an ultimate report that you hope to have at the end of whatever the interim length of time is?
Just about everybody knows somebody, a friend or a family member who's struggled with addiction issues in this state. And we also know that what we're seeing in our communities and our streets isn't unacceptable. We have sort of two tasks ahead of us. One, what are the immediate steps that we can take to help folks who are in crisis get from crisis to stability? What are the immediate steps we can take to help increase the safety in our communities? That's the 2024 sort of mandate, as we have 35 legislative days to take action. And then there's a larger vision here. How do we make sure that we have the treatment and addiction infrastructure in place in states so everybody who needs help can access that help? So I look at this committee as what are the immediate steps we can take, and how do we make sure that we have a long-term vision and commitment to tackling this issue here in Oregon? Is
your committee also kind of looking at Oregon, the state, after the passage of Measure 110 and looking at is there some causality for Measure 110 and the problems that we might be seeing on our streets?
Yeah, I would say we're taking sort of some people want to call this a Measure 110 committee. We're taking a larger view, taking a more holistic view of what the issue here is in our community. So we're looking at how is addiction impacting communities throughout our state? What are the services that we need to have in place to help people who are struggling with addiction? And what are the steps that we need to take right now to help create safer communities? Measure 10 is certainly part of that. And Measure 10 has sort of multiple pieces of it. One part of it is increased funding for substance abuse treatment providers throughout our state. And, an example that really hit home for me is I went out and toured an addiction treatment program that we have for juveniles out in Prineville. They're one of the few inpatient juvenile treatment providers here in the state. And in talking with them, they receive money from the passage of Measure 110, and those dollars are helping keep that program's doors open. And I don't want to go backwards on how we're supporting and funding addiction services. We know we need to do more. There are a number of different questions out there about the impact of decriminalization of small amounts of drugs. And we're taking a look at that. And so we're trying to decipher, what was, when the voters passed this measure, what is working right now in some and I would say things that are working are, dollars getting to that treatment program in Prineville and keeping that program afloat to help young people, especially on this side of the state. We're trying to figure out what's not working and why those things working. And when people bring us suggestions and ideas, what is going to be effective?
Sure. I imagine whether it's constituents or other members of the legislature might talk to you and say, hey, and we've certainly heard this in preparing for this show and talking to people, for example, in law enforcement, saying, we think Measure 110 was a really bad idea, and we think it's a reason for why we're seeing such an increase in problems like drug overdoses. I don't know, what have people in your circle, your constituents, other members of the legislature, or just people that you have course to talk about, have they come to you and said, we need to repeal this?
Yeah, I think, and let me back up a little bit. So
Sure.
One, we are trying to hear from as many different stakeholders as possible as we're in this process, right? So our first meeting, we heard from treatment providers throughout the state to try to make sure we had an understanding of what are the treatment services that are out there, and a growing appreciation of what are the gaps and where do we need to make improvements. The next meeting we have on Monday is we've invited law enforcement officials from throughout the state. So we're going to hear from police officers from throughout the state. What are they seeing in their communities? What are the tools that they have? What are the tools that they need? We're hearing from the president of the District Attorneys Association, and we're hearing from folks from probation departments. So we've got the public health perspective. We're going to get the law enforcement perspective. So we're trying to take in as much information as possible, make sure that everybody on the committee appreciates what the problem is, make sure we're asking the right questions, and we are taking in the right information when we're considering decisions coming up in 24. I think I've been hearing folks want services and help for those who are in crisis, right? We want people who are in crisis, who are on our streets, who are struggling with mental health issues or struggling with addiction issues, to get help. Fentanyl is a relatively new phenomenon in the state from the last few years, as it moved its way from the East Coast to the West Coast. And we now have a drug that's cheaper, more addictive, and more lethal than something that I'd seen in my career. I was a prosecutor for 15 and a half years. So
fentanyl really is kind of a game changer, isn't it?
It is. So I was a public defender at the beginning of my career in Portland and Bend, and then I was a prosecutor. So I've been in the criminal justice system for, 20 plus years before I became a legislator. Yes, it is just a different beast. I mean, when I was up in Portland meeting with folks, and they talked about it being $1 or $2 for a pill, so cheaper than anything we'd seen. The lethality of that is greatly increased from other drugs, right? When we talk about the overdose rate going up in this country, in the state, it is mainly attributed to fentanyl, and it's just more dangerous and more addictive and cheaper. We have to make sure that our law enforcement and our prosecutors have the tools they need to prosecute folks who profit off the addiction of others. And that is part of the discussion we're going to have on Monday. What do we need to do to cut down on the supply of drugs that's in our community?
Well, Representative Jason Krupp from Bend, thank you so much for talking with us.
Thanks, Michael.
I'm Michael Dunn, and you're listening to Oregon on the Record from KLCC and our show about drug use and the impacts of Measure 110. Now you'll hear from a Lane County official who thinks the problem with Measure 110 isn't decriminalization, but a delay in funding for addiction treatment. Alexander Levake, the Overdose Prevention Coordinator for Lane County Public Health, thanks so much for coming in and talking to us.
Sure, it's great to be here.
Drug overdoses, are they increasing? Drug impacts, kind of what's the lay of the land as you've done your job as the Overdose Coordinator?
Here in Lane County, and very specifically to our metro area of Eugene, Springfield, we're seeing increased drug overdose and impact from fentanyl pretty similarly to other West Coast cities.
So fentanyl is, everybody's talking about it. Talk about fentanyl specifically, and I know that you sort of, manage a program to kind of track fentanyl overdoses. Talk about what you've seen in that program.
Yeah, we are seeing fentanyl nationwide.
Okay.
It's an extremely potent, illicit synthetic opioid that has made its way into many, many communities. It's got extreme addictive qualities. It's very powerful, so the risk of overdose is higher than other opioids we've seen in the past. What we do at the county is we watch the data.
Okay.
We track our hospitalizations. We look at mortality. We're able to sort of assess where we stand in things. There's never not overdoses, but we are looking week to week at how do things fluctuate over time. Unfortunately, in the year that we're in, we see more overdoses than this time last year or the year prior.
Can you draw any conclusions about Measure 110 or not?
We can say that the first thing Measure 110 impacted was decriminalizing the substances, right? It's slowing down the rate of people going in and out of jail for the same problems. What we can't say yet is how the funding that came from Measure 110 is going to reveal impact. We have programs that are only being stood up today. People being hired now. So the 2 years in between the beginning and now, it's just not enough time to see where the funding and increased capacity for treatment and care is going to look like.
Obviously, law enforcement is one side of the issue when it comes to illicit drugs, but there's also education and prevention and stuff. And I'm wondering, especially around something like fentanyl, which in the grand scheme of drugs is a fairly new phenomenon. And I'm wondering, from your perspective about educating how dangerous it is. Do you think that in and of itself can have a measurable impact on people using it?
We do think education is an upstream and a powerful way to raise awareness and normalize conversations and not stigmatize drugs the way we have in the past. I would argue that our just say no models went from just say no to just say nothing. And in our environment today for young people, there's a lot of misinformation and there's a lot of people just not having conversations, whether it's our schools or our families. So the county's developed a campaign in order to address that. It's Fentanyl Aware Lane County, and we're in many school districts, in many community orgs, just simply raising awareness so that this conversation can be sparked.
Yeah. And certainly, if anybody paying attention to the news, hears about fentanyl and hears about overdoses, and also hears about the fact that sometimes fentanyl finds its way into a substance, and so a user may not know that fentanyl's in there and then take it, and then obviously terrible circumstances happen. That happens a lot, doesn't it?
That is a fear and risk that is happening. We have a lot of folks that have long-term opioid addiction and dependency. They are using fentanyl because that's the drug that is available on the street. It's cheap and strong. So a lot of people are using fentanyl because they're using fentanyl, right?
Yeah.
And they need help in a different way. Then we also see what we would consider cross-contamination. Drugs are split up and dealt and packaged in very unregulated places. So we do know the risk of other drugs containing fentanyl, whether it's intentional or not, doesn't even matter because it means people are at risk. We're also concerned with the fact that fentanyl shows up often in pressed pills to look just like pharmaceutical drugs. And regardless of who you are, we don't have a fear of pills in this community. I should say in this society, pills are very much used for good. We've all taken pills at some point in our lives, so we don't have a perceived risk around pills that came from a friend of a friend of a friend. We don't know what the source of those pills are, and now the deadliest, nastiest drug in our history is often in pill form.
Alexander Levesque, the overdose prevention coordinator with Lane County Public Health. Thanks so much for coming in and talking to us.
Great. Thank you.
I'm Michael Dunn, and you're listening to Oregon on the Record. Our next guest was part of a complex study to look at the impacts of Measure 110. What they found is that, yes, drug overdoses are up, but that they're up everywhere, including 13 other states that don't have a Measure 110 decriminalization policy. Corey Davis, an assistant clinical professor at NYU's Grossman School of Medicine, as well as the director of the Harm Reduction Legal Project at the Network for Public Health Law. Thanks so much for talking with us.
Sure, happy to be here.
Yeah. I know you were part of a study into the impacts of drug decriminalization policies, including a very significant one here in Oregon. Can you give us just a general overview of what your research showed?
Sure. We actually published two papers. One looked at the impact of Measure 110 on drug arrests and other arrests in Oregon. And the second one looked at the impact of Measure 110 on fatal overdoses in Oregon.
Okay.
And we found, kind of unsurprisingly with the first one, that drug arrests did go down quite a bit, as could be expected. And with the second one, we found no significant change. We found that Measure 110, in the first year after it was implemented, didn't seem to have any significant impact on fatal drug overdoses in Oregon.
And as I understand it, in your study, you looked at other states as well, which I guess, generally we're seeing some increases with related to drugs. But again, your study showed that, Measure 110 seemingly didn't have an impact in terms of those fatal drug overdoses. But we're seeing increases in a lot of places. Is that correct?
Yeah, that's right. So the study design, attempted to tease out the impact, if any, of Measure 110 on overdoses.
Mm-hmm.
It is true, as you said, that overdoses have been going up in Oregon, continue to go up in Oregon during the study period. And that was true of most states in the United States. We're in unfortunately, a decade plus long string of increases in fatal drug overdoses pretty much throughout the country. And that was true in Oregon as well.
Mm-hmm. And I'm not sure if it's in the parameters of your study, but do you have any ideas why that decades-long increase in drug overdoses has been occurring?
Yeah, I mean, we have a pretty good idea. And, in this field, we think about it in terms of kind of three waves. The first wave of overdose deaths was related to increases in heroin use.
Okay.
And then prescription drug use. And the last few years, it's almost solely been driven by fentanyl, which a lot of people have heard about. But fentanyl is a synthetic opioid. Almost all of the fentanyl in the drug supply is not diverted pharmaceutical fentanyl. It's illicitly made fentanyl that is, just spreading throughout the country and has been doing that over the past few years. That's my view, and it's the view of most, drug policy researchers, is that the increase that we've seen over the past, 4 or 5 years throughout the country is largely attributable to this increase in fentanyl contamination in the illicit drug supply. And I mean, to explain our methods a little bit, what we did was we compared, we looked at all of the states in the country in the period before Measure 110 passed. And we looked to see which of them had the trajectory that was closest to Oregon in the pre-study period, right? So we call those, those are our comparator states, or in this method, we call them the donor states.
Okay.
And the idea is that because Oregon was moving most closely to those states before Measure 110 passed, and we would assume that after Measure 110 passed, it would continue to follow the same general trajectory of those states. So we just, it's a little more complicated than that, but then we look to see, was there a difference after Measure 110 went into effect in Oregon and didn't go into effect in those other dozen states? Did we see a difference in the trajectory? And we didn't. That's a method called the synthetic control method. I think that some people don't really understand is that we're not saying that overdoses didn't go up in Oregon.
Mm-hmm.
They did. What we're saying is that they didn't seem to have gone up more in Oregon after Measure 110 passed than we would have expected them to go up had Measure 110 not passed. In other words, overdoses were on the rise beforehand. They continued to rise in Oregon, and they continued to rise in the states that were most similar to Oregon before Measure 110 passed.
Okay. Okay.
I mean, part of the reason that we wanted to do this study is because Measure 110 was relatively unique, and we wanted to see what would happen. Um, yeah, and there's always people who are going to be unhappy. I would say, as a non-Oregonian,
Mm-hmm.
I actually thought that it would be the folks who were supporters of Measure 110 who would be upset with the findings because, when Measure 110 was being debated and discussed, one of the selling points that proponents put forward, and I think that they were very sincere in this, was that it would help reduce overdose deaths.
Yeah.
And, we found that at least in the first year, it didn't seem to do that. So I was actually a bit surprised, not being steeped in Oregon politics,
Sure.
that in fact it was the opponents who who were upset at the findings. But I mean, it is what it is,
Yeah.
and like I said, it's only the first year. Afterwards, I know that proponents of Measure 110 point out that Measure 110 not only just decriminalized drugs, but it also had this big investments in treatment and prevention and harm reduction that, that money took a while to roll out.
Yeah.
So I think that they're still hopeful that in longer terms, there will be a reduction. But, we don't know. We didn't look at that.
Sure.
And once those data are available, hopefully we'll be able to look at them.
Okay. Okay. Do we need to rethink how we combat this, and that the idea that maybe something like more interdiction, more education at the front end it might be able to be a better solution than trying to aim local, state, federal law enforcement agencies solely at the problem?
I mean, that was my understanding is kind of the guiding idea behind Measure 110, that the traditional, methods that are heavy on law enforcement. In Oregon is actually particularly bad at treatment access, depending on how you measure it. It's something like 45th in the country as far as access to, to drug treatment. That what was happening before wasn't working. And I think that is pretty clear when you look at our record number of overdose deaths and the fact that they've been increasing pretty much year over year, like I said, for more than a decade. So in my mind, it is, the empirical evidence shows pretty clearly that what we've been doing, hasn't worked. And that's partly, like I said, why we were so interested in, studying Measure 110, because it shows, it's an example of a state trying something different. I think of it as like a pragmatic, real world view of drug use and drug policy, like trying to find out, okay, if we put aside our preconceived notions, what actually works? Like, what does the evidence tell us actually works? And, the empirical evidence for locking up people who have a substance use disorder, not providing them with treatment, not providing them, for example, if they are unhoused and don't have a job with the resources to get those things, it doesn't do anything to reduce drug-related harm, either to the individual or to society. And I think that, my perception is that a lot of policymakers and even law enforcement officials and so on understand that. So we're interested in, okay, what does work? What should we be doing? As a country, as a state, as a society, to actually try to improve outcomes, both for the people who are using drugs and for the broader community. And yeah, so that's, I would say that kind of drove our interest in looking at Measure 110.
Got it. Well, Corey Davis, assistant clinical professor at NYU's Grossman School of Medicine, as well as the director of the Harm Reduction Legal Project at the Network for Public Health Law, thanks so much for talking with us about this very complex issue.
Yeah, my pleasure.
I'm Michael Dunn, and you're listening to Oregon on the Record and our show about drug policy. Up next, we talk with a Eugene police officer who sees the drug crisis up close and thinks Measure 110 has been an accelerant to the problem. Street Crimes Officer Brad Hanneman with the Eugene Police Department, thanks so much for coming in and talking to us.
You're welcome. It's good to be here.
Yeah. So just generally speaking, what is EPD seeing in terms of drug use, arrests, overdoses in Eugene, let's say, for 2023?
It's been busy and steady. The last 2 years of 22 and 23 so far has proven to be that the drugs that we're seeing are still coming in, even though we're putting together really good investigations. It's just really hard to. It's not a trickle. It's just a massive amount of drugs that are here.
And have you seen that increase? Can you pinpoint sort of maybe when that increase started? Was it a few years ago, a year ago? Kind of what does your data kind of show you?
I would say that we don't have any real data on that, but when years ago, 10 or 12 years ago, there was an INET, or Interagency Narcotics Enforcement Team. I don't know exactly what kind of haul they were getting on search warrants, but I think on average, a search warrant for our team, and we're not even a narcotics team, is going to be anywhere in the half pound to multiple pound level. Oh, wow. Which is not something that was that I was hearing 10 years ago.
Okay, so it's not just number of incidents; it's just quantity on the street. Is that correct?
Yeah, the volume is pretty insane right now.
Yeah, and I've heard fentanyl. Is that what you're seeing? Is that kind of the main sort of drug that you're seeing in our community that is such a concern?
Fentanyl seems to be the drug of choice. I would say methamphetamine is still, reigns as that drug of choice. But we're finding fentanyl is in just about everything. So it would be in methamphetamine or heroin, cocaine, fentanyl in its pure form, in counterfeit Oxy 30 form. The organics are kind of out. The synthetics are sort of coming in. Methamphetamine was, of course, the first synthetic that really started to rear its ugly head years and years ago.
So you're talking you mean organics being like plant-based cocaine versus like heroin, fentanyl and
correct.
Methadone.
Yeah, we're not seeing so much heroin. We are seeing an influx of cocaine. So I don't really know exactly how or why those things are happening, but we just know they are happening.
Okay. Yeah, because I was going to ask you if there's anything you can look at and say, oh, this is why there's an increase. Is it just the fact that, as I've heard, fentanyl is pretty easy to make and pretty cheap? Is that one of the reasons?
Well, it's not being, if it's being manufactured here, I'm not aware of that.
I see. Okay.
It's still being manufactured in Mexico.
Okay.
I have my own suppositions on why we're seeing this influx. I think Measure 110 has a lot to do with it. Okay. And I also see the problems at the border right now as being where it's so porous that a lot of these things are coming in.
Okay. Yeah, obviously Measure 110 a few years ago, what was passed by the voters. And so is that kind of, you're looking at that and saying, okay, well, obviously if we can't arrest people for drug possession, that's it. Where do you come down on that?
Well, as far as the measure, I think there was good intentions behind it. There was no infrastructure to support it. Okay. When I've talked to anybody on the street, I generally ask them a question about Measure 110, and if they don't know about it, then I explain it to them. Okay. And once they've heard it, they're like, oh yeah, I know about that. Basically, it hasn't helped anything. It's actually made things worse. I know from a law enforcement standpoint, Measure 110 as a measure created some substantially bad case law for us to work around now. And that case law can't be repealed unlike a measure can.
I see. So there's been this study out about Measure 110, and what the findings suggest is that indeed, absolutely, drug overdoses and problems such as that are certainly going up in our state, but they're also going up in a whole bunch of other states that they use as a control group. And so their findings were along the lines of, it can't be Measure 110, there must be something else going on. I want to ask you kind of your reaction to that, but also just sort of what you're seeing here on the streets in Eugene.
I'm sure that the people that do a lot of these studies, they they have the time and the degrees to do that. I don't have a degree, and I don't need a degree to tell you that Measure 110 went into effect in, I think it was February of 21. That year, there was 565 overdoses. The next year, there was 823 overdoses.
So a big increase.
And then this year, so far, 858 overdoses. So the data can be skewed. These are just Eugene numbers. These are not covering Springfield or Lane County. These are Eugene numbers. And that's what I have to pay attention to. That's what we pay attention to. Whether are overdoses going up all over the place? Heck yes, they are. The reason they are probably is because the introduction of fentanyl. It has kind of just spread across the entire United States. It takes us about maybe 2 months to realize what's occurring at the border here. So what we see at the border, get reports on different fentanyl or carfentanil or something coming across the border. We may not realize that here in Oregon for probably 2 months.
As a cop, you're used to, I imagine, throughout your career, arresting people who have drugs in their possession. What's it like after Measure 110, maybe seeing that same circumstance that maybe 5 years ago would have been, oh, that's a clear case of arrest, and now it's not? I guess just, what is it? Is it a challenge mentally, or just kind of in your training to sort of have to adjudicate that situation instantaneously?
Well, I mean, I think we're constantly adjusting in law enforcement, and I'll just use an example of marijuana. When I started in law enforcement 15 years ago, marijuana was illegal.
Sure.
And so you could do things just on your smell. Right? I could search somebody's pockets, or I could, and that was a jailable offense to possess marijuana. And most people would get a ticket. But then slowly the medicinal marijuana started getting talked about.
Okay.
And what we were seeing is, from a patrol standpoint, what I was seeing is basically not doing any prosecutions on user amounts of marijuana, especially if somebody said that it was for medical purposes.
Okay.
And then, of course, the law, changed to where marijuana was legal, and then there were stipulations behind that, and so everything evolved.
I see.
With that, and I don't know if it's an evolution or a devolution of things, but either way, we had to make our adjustments that way.
Sure. I imagine you have opportunities to talk to law enforcement officers in other communities. What's been the general consensus, maybe if you've talked to police officers in rural towns in Oregon, and also perhaps people up in Portland or other big cities, about what they're seeing in terms of drug overdoses or drug use, and then perhaps even some opinions about Measure 110 from that community as well, fellow officers.
Yeah, and I don't know that I think all the officers that I've talked to, like the Oregon Narcotics Officers Association this last summer, Measure 110 is just not something that's good for anybody. It doesn't really help us for law enforcement. It's definitely not helping the addicts. The e-violations were really kind of disjointed, and how they were going to go out, where they were going to go, who's going to get those.
Could you explain the e-violation real quick?
Well, so it made it so Measure 110, they created an e-violation, which if you get a ticket, but it wasn't a it wasn't like a citation in lieu of custody. What it was is it was a summons to appear, and you're also provided with a phone number to call. And the hope was that people would call this number to avoid paying a $100 fine for possession of hard narcotics. Unfortunately, a lot of people didn't call. In fact, most of the people didn't call, and really it never gained any steam. There wasn't a whole lot of citations issued the way I understand it, even throughout the entire state. As far as overdoses go, that's a just ongoing trend, and it's a trend that's going upward. I think there's right around 219 overdose deaths a year or a day in the United States.
Wow.
Right now we've eclipsed 2022 in overdoses. And I don't have the hard numbers on overdose deaths, but we have eclipsed that number, and we still have a couple more months to go.
Well, Brad Hanneman, he's a street crimes officer with the Eugene Police Department. Thanks so much for talking to us.
You're welcome.
I'm Michael Dunn, and you're listening to Oregon on the Record from KLCC and our show about the state's drug policy. The next person you'll hear is someone who's seen the very worst of what drugs can do. She's a former drug abuser and inmate who is now part of a task force that's helping Oregon figure out what the best policies are to help those in the grip of addiction. Morgan Godvin, a drug policy researcher and an appointee to the Oregon's Measure 110 Oversight and Accountability Council. Thanks so much for jumping on and talking with us.
Thank you so much for having me.
Yeah. Can you sort of talk about your own experience with the criminal justice system, related to drug crimes?
When I was about 20 years old, I switched from oxycodone to a heroin addiction, as was very common at the time. I was able to go several years actually without getting arrested. I'm white and middle class. I was using military education benefits to go to school. I was working, but all of that came crashing down when I was 23 years old, when I was arrested for felony drug possession and put into drug court, which we were calling kinder, gentler alternative to incarceration.
I see.
But that's not exactly how it played out for me.
Well, as much as you'd care to share, what was that like?
I had got my EMT license. I was going to paramedic school. I thought if I could create a life worth living, I would finally stop using. But, my addiction had brought natural consequences onto me, and that wasn't enough to make me stop. Addiction is defined as continued use despite repeated negative consequences. So when the criminal justice system stepped in and said, we're going to give you even more consequences if you don't stop. So I went to treatment. I was very fortunate. I had private health insurance. Even when they mandate you to treatment, it's still up to you to find your own bed and pay your own way, which I always found bizarre. But I was able to go to treatment. And then the day I discharged from treatment, my car had been parked at the treatment center for 28 days. And it was filthy from, just my addiction and being a pig. And I got pulled over that night, and a Washington County Sheriff's deputy gave me a drug possession felony for an empty plastic bag he found on my floorboard that had at one time contained drugs. But I'm in drug court, right? I have to check in with the drug court judge every week. And so I concoct this plan, and I think it's brilliant. I go to my Suboxone doctor. I get a letter from the doctor imploring the courts to keep me on this life-saving medication. And I take the written prescription, the physical medication in that letter, and I walk into my drug court check-in with Judge Ryan, and I ask to be taken into custody for a 7-day jail stabilization because I want my free will out of the equation. The system that is ostensibly here to help me, right? Why else do we put drug users in the criminal justice system? Why else do we put them into drug court? So I leaned in, said, you know what? You're right. I need some help. I'll do a jail stabilization so that I can get 7 days of sobriety with just my medication. And then I'll finally have the foundation I need for the rest of my life. And the bailiff handcuffed me, lodged me in the jail with my medication. And when I got to Inverness and put in a medical request, the nurse pulled me back to medical and laughed in my face and told me that they do not prescribe Suboxone for opioid use disorder in the county jail. Now, this was 2013. They still do not today. The vast majority of American jails and prisons do not prescribe the gold standard medication for opioid addiction. So what are we actually doing? I was force detoxed under fluorescent lights that never turned off, vomiting into a trash can while 77 other women looked on, not even provided so much as a cup to drink water out of, having to walk 60 feet to the drinking fountain every time I wanted a sip of water, becoming terribly dehydrated. And then after 7 days, my sentence was over, being released back to the exact same circumstances from whence I came, relapsing in less than an hour. I'm lucky that I didn't overdose and die, because those first days after release, we know to be an incredibly dangerous time for drug overdose.
Yeah. I mean,
I never took medication again after that.
okay.
I resigned myself to a life of death and heroin addiction.
And how did you get from there to where you are today?
So that was my first time in jail. I was sanctioned again to jail about 2 weeks later. At that point, I lost my job. And I middlemanned a gram of heroin to one of my best friends in the world. And he overdosed and died alone in his apartment. And I was only informed of that the next night when the SWAT team raided me and informed me that I was being arrested for drug delivery resulting in death, a federal charge that carries a 20-year mandatory minimum sentence. I'm, again, white and middle class. I was very privileged. I only got 5 years. And I continued using in jail for the first 2 of those years until I finally decided to find my sobriety by asking to be transferred to a facility that had less drugs and really trying to work on my spirituality and self-help. So my sobriety is despite my incarceration, not because of it. I met a Portuguese man today. I'm in Lisbon studying drug policy reform. And I asked him if he was afraid of the police. He didn't understand my question. He was homeless, a daily crack smoker. He said, "But why would I be afraid of the police? What do you mean?" And I couldn't understand his disbelief. For years in my addiction, I just wanted to make it from work to the drug dealer to home without getting arrested and strip searched and thrown into jail first. And the police really set out to play this game of cat and mouse where they were pulling me over once a week, at least twice a month, because I'm driving late at night in a car that indicates I am poor. And therefore am probably a drug user. And so I just saw this level of punishment coming from our criminal justice system that I wasn't raised to fear police. My mom was active duty military. I joined the Air Force. I learned to fear police through repeated interactions with them where they were being so cruel to me, violating basic tenets of human dignity. And why? Because heroin is my drug of choice and not alcohol. I didn't commit crime, but I did use drugs. And in the eyes of the law at that time, that made me a criminal. I have been raided by the SWAT team twice in my life. And yet I never saw more than a few $100s worth of drugs at a time. I was absolutely a blue-collar junkie. And the level of resources that they invested into pursuing and punishing me and all my friends, especially my friend Justin, who would later become my victim in that federal drug delivery resulting in death case, he was incarcerated 12 times, sentenced to prison. The only thing in his wallet the day he died was his Clackamas County jail ID. But yet, upon his death, they determined he was a victim only insofar as that victimhood could go towards incarcerating other drug users.
So let's talk about this measure of which you're on the advisory panel for. You know, what's your hope? What's your assessment of Measure 110? In terms of the passage that happened several years ago to where it is today.
arresting people for low-level drug possession does nothing but produce harm. We know that. All other 49 states in the country show us that. Oregon actually has an overdose rate that is below the national average. 25 US states have a higher overdose rate than we do. So essentially what decriminalization does is it, first thing, do no harm. It stops the harm production that was coming out of the criminal justice system. We know that a state's drug laws have no effect on the substance use, addiction, or overdose rate in that state. And decriminalization does not solve our social problems.
Mm-hmm.
Decriminalization does not suddenly create an on-demand treatment system of patient-centered evidence-based care. So we are in that next phase now, beyond do no harm, into healing. And in the American context, without universal health care, with this historically recalcitrant to harm reduction, abstinence-focused Christian 12-step inflected treatment system, we have a long way to catch up. Oregon ranked last or next to last in access to treatment for almost 2 decades. Even as fentanyl was introduced into the drug supply in the Northeast and was making an inexorable westward march, we did not prepare. We were one of the last states to get fentanyl, and we did nothing. We were still ranking last in access to treatment when fentanyl finally came knocking at our door, as drug policy experts had been warning that it would for 9 years. So now we are scrambling. A single round of Measure 110 grant funding did not undo 2 decades of divestment. That is going to take us several rounds. And Measure 110 cannot be solely relied upon to fix our cascading, intersecting social problems, especially exacerbated by our housing crisis and homelessness.
What do you hope, utilizing Measure 110, but probably other steps as well, what's your hope for where our state in Oregon can get to?
We need a single point of contact steering the ship. All of our services are so incredibly siloed. We are last in outcomes, but not last in spending. So there is a disconnect between the resources we are investing and what we are getting out of them. And I believe that is because there has been a total breakdown of coordination across all levels of government. So at the state level, even between different state agencies, between the states and the counties, between county and metro and the city, there is no one steering the ship. So if we can come together and coordinate our services and have harm reduction be a current that runs through everything instead of siloed off in the corner. I've seen it here in Lisbon. All of their treatment services have harm reduction woven into them because they believe the goal is to persuade people to stop using, but not coerce them. Because attempts at coercion very often cause people to withdraw, and then they become even harder to access. And so paradoxically, though they do not coerce here, they have a higher success rate on bringing people into recovery than we do in the United States, where we paint it as black and white. Either you stop using or you go to jail. These are your options.
Morgan Godwin, who's a drug policy researcher and is part of the Oregon's Measure 110 Oversight and Accountability Council, really appreciate your not only sharing your information, but sharing your story with us.
Of course, it informs everything that I do. It's the fuel that lights my fire.
That's our show. No one could blame you if you feel like our society's position on drugs creates a whiplash effect. From a total just say no war on drugs stance to the pendulum swinging to legal pot, legal psilocybin, and Measure 110. And on that last one, there's no shortage of opinion about where the pendulum needs to swing more forcefully towards an outright repeal and going back to the way it was in Oregon, or towards some adjustments and a deliberate swing towards education and addiction treatment. I want to thank my guests for coming on the show and talking with us. Oregon Representative Jason Krupp and Alexander Levesque from Lane County Public Health, Corey Davis of NYU and the Network for Public Health, Officer Brad Hanneman of Eugene Police Department, and Morgan Godvin, drug policy researcher and Measure 110 Oversight Council member. This show, along with all episodes of Oregon on the Record, is available at klcc.org. I'm Michael Dunn, and this has been Oregon on the Record from KLCC.